Hi everyone, my name is Shreya.
Hi, my name's Natalie, and we're both alumni from the class of 2025 at UVA's Post-Bacc pre-med program. Before we dive into some details about the program, we want to note that this program is specifically for career changers, and that means it's for students who have some exposure to healthcare but haven't taken many of the necessary prereqs for medical school and have not yet taken the MCAT. This is in contrast to programs that are designed for academic record enhancement, which we'll discuss and talk about a little bit later. So, if you're someone who's looking to improve your undergraduate pre-med record, repeat prerequisite classes, and or retake the MCAT, an academic record enhancement program might be the best fit for you. Here at UVA, we are programs specifically designed for career changers, not academic record enhancers. However, we can occasionally accommodate some students with previous science coursework if it was taken 5 or more years ago, and if you need minimal coursework substitutions.
So I'm going to go over a little bit about what the timeline looks like. So you'll be taking your major pre-medical prerequisite courses in 11 months. So it is a busy time, but it is also nice that you don't really have time in between to forget what you just learned. So your summer will be general chemistry 1 and 2 with lab, and your fall will be bio with lab, orgo with lab, physics with lab. And the spring will be bio with lab, orgo with lab, physics with lab, and biochemistry. So that's a busy semester. And you will also have a weekly US healthcare seminar. So that is a pass fail class taught by Dr. Hoke, who is a physician at the University of Virginia. And I think that was one of my favorite parts of the program, where you get some insight into the type of discrepancies that exist in the US healthcare system. And it's really valuable that you get some of that knowledge before even starting medical school. You'll also have access to clinical volunteer and shadowing opportunities, which we'll talk about a little bit more later. And you have access to personalized advising both during the program and after in your glide year or glide multiple years. And there are also linkage agreements with a couple of med schools, which we'll touch on more later. But that would essentially mean that you would start medical school if you apply and are accepted to one of these linkages, and would start right after your post-bac instead of taking glide years.
So the program begins in the summer with general chemistry. Monday through Friday, you'll typically have lecture in the morning and lab in the afternoon, with an optional homework review session held in the evenings. The summer session is really a time where you'll become super close with your fellow cohort members and start to get a feel for the type of coursework and knowledge that's required to successfully complete the post-bac program.
Here is a sample of what your fall weekly schedule could look like. So you have a little bit more diversity in your days. So you have orgo, biophysics, and you start your US healthcare class. And you can see there are still some pockets of free time in between, which you can use to study or get lunch with your friends on grounds.
So, spring semester is structured in a very similar way to the fall semester, but with the addition of biochemistry coursework on Tuesdays and Thursdays. Spring semester may also look a little different for those who are planning on taking the MCAT immediately following the program's completion in May. The program also offers optional MCAT tutoring sessions and full-length mock exams during the weekends of your spring semester.
So the academics at UVA, all of your classes will be taking in place on grounds in person with faculty from the College of Arts and Sciences. And those faculty members are very approachable and accessible. They encourage you to ask questions in class and all host office hours. But in addition to that, you have dedicated teaching assistants who walk around in class answering questions and host their own office hours. So I would say between those office hours and the ones with the faculty, you can pretty much always get your questions answered. Professor Serbulia is the academic director, and she's been with the program since 2018. She teaches organic chemistry in both the fall and spring, so you'll get to know her well. And she is available to post-baccs during all 3 semesters for academic support and advice, and she is really amazing.
So this is US healthcare class. Some of my favorite memories come from US healthcare class on Wednesday afternoons. But here's Dr. Hoke pictured here. He's our medical advisor for the program and in charge of our US healthcare class. Dr. Hoke is an associate professor at UVA School of Medicine and the health systems where he founded the academic hospitalist program. This seminar style class teaches students on the structure, function, financing, and challenges of the American healthcare system. We have many guest lectures and often discuss current events and bioethical case studies. Dr. Hoke also supervises and coordinates clinical orientations and shadowing experiences so we can get direct exposure to patient care and medical practice during our time at the Post-Bacc.
Your advisors and career coaches will be Jill and Susan, who are pictured in the bottom right here. They are incredibly knowledgeable about the med school admissions process. They have over 30 years of admissions and advising experience, and they will also give you personalized advising both during the program, and they're very accessible in your glide year or years. As someone who's in a glide year now, I can say I still regularly meet with them. And they can specifically help with creating thoughtful application materials. So helping you brainstorm essays and edit, and they will help you construct a well-researched and balanced school list, which I think is a very important step in the medical school application process. And they'll also, mostly in your glide years, help you improve your interviewing skills and do mock interviews with you. And besides those more structured meetings, they are also available for general advising on academics or any questions you might have on the admissions process.
As a student at UVA's Post-Bacc program, you'll have access to the medical school admissions requirement website through the AAMC. Access to this database is essential in creating those school lists when applying to medical school. We're also given access to UWorld to best support our MCAT preparation. The UWorld question bank currently features over 3,000 practice questions with detailed explanations. And it's often cited as one of the best prep materials for the MCAT. I know Shreya and I both religiously used UWorld to help us succeed on our MCAT exams. The program also offers UVA specific MCAT prep recommendations and guidelines that are really tailored towards you and the rest of your cohort. Becoming a student at UVA also grants you access to our expansive alumni network, including Shreya and I, which is really helpful for anything regarding academics, glide year positions, and the medical school application process.
So I'm going to talk about what some of the clinical volunteering opportunities look like. A lot of students choose to volunteer directly with UVA Health. So that is a weekly commitment that follows through both the fall and spring semesters. There are a lot of different positions, including at the Children's Hospital, Cancer Center, Emergency Department, Cardiology Unit, Outpatient Surgical Lounge, as well as other departments potentially, depending on the year. So you can really get a feel for a lot of different specialties. I personally volunteered at the Charlottesville Free Clinic. So that is a monthly commitment, also goes both through the fall and spring, but you can volunteer more than once a month if you'd like to. If you have some prior medical training or certification for patient care roles, you could serve as a medical scribe or as a nurse. I personally volunteered, and those positions are available as a pharmacy technician, financial eligibility counselor, or exit interviewer. And I think it's a really great way to make an impact in your community.
Some additional volunteering and shadowing opportunities include UVA population health, which is done during school breaks, and students can shadow healthcare providers practicing medicine outside of strictly clinical environments. So some community outreach programs include community paramedicine, which is something that I shadowed during my time at UVA, continuum home health, homelessness, consult service, well aware, and medicine home. The Charlottesville Albemarle Cars Rescue Squad. This is 6 or 12-hour ride-alongs with experienced emergency services, and the region covers Charlottesville City, University of Virginia, and parts of Albemarle County. The other opportunity that I also participated was being able to attend the Medical Ethics Committee. So this is an opportunity where we can virtually shadow the UVA Health's Medical Ethics Committee meetings. We can learn from various healthcare providers as they discuss real-life complex patient cases.
University of Virginia also allows you opportunities to shadow, which I really appreciated. And they have a lot of different specialties that you could choose from, including anesthesiology, emergency medicine, family medicine, internal medicine, labor and delivery, which is where I shadowed, physical medicine and rehabilitation, psychiatry, and surgery. So I think it's a really great way to kind of get an idea of what different specialties you might be interested in, even before you start medical school, and to kind of get a better idea of what a day in the life of a doctor looks like.
So, what's it like being a PBPM student at UVA? All of our classes are held on campus, also known as grounds at UVA, and we receive all access to university libraries, support services, fitness centers, and sporting events. Each PBPM student also receives a UVA Health Systems ID badge, which is super helpful for both shadowing and volunteering through the UVA Health System. And having access to the Health Sciences Library, also known as the Med School Library, is great because it's often a lot less crowded than the other libraries on campus and is open 24/7.
I'm going to talk a little bit about what it's like to live in Charlottesville. I personally really enjoyed my time in the city. There's a lot of great nature there. You could hike Shenandoah National Park and you can enjoy the Blue Ridge Mountains. I personally did make the trek to the national park a couple times, but if you want to stay in the city, there are also a lot of great walking and running trails there. You can also enjoy beverages at a lot of different coffee shops. I tried to study at a different coffee shop every weekend in the fall. And there's also a lot of wineries, breweries, and distilleries as well. The food scene is really great. I especially enjoyed Restaurant Week, where you can enjoy the gourmet restaurants in Charlottesville for a much discounted price. And there is always live music, and it's really amazing. And that is often an either free or cheap option as well. So the city is really wonderful.
Where do our students go after completing the program? We have a 94% acceptance rate into medical schools, and here are a small sample list of some of the schools our alumni have attended. And if you're curious, you can find a more complete list on our website. Many of these successful students are present in our alumni network, like Shreya and I are, and we're happy to connect with current students who are looking for school-specific insight and advice. We also are lucky to have two linkage agreements through the Post-Bacc, one of them being Pitt and the other being Virginia College of Osteopathic Medicine.
What does an ideal candidate look like? So ideally, you would have little to no science background. You haven't taken a lot of the prerequisites, or if you have, it's been a long time. With a solid undergraduate GPA, strong test scores, so SAT, ACT, or GRE. Ideally, you would have some clinical experience shadowing and or medical exposure. However, you will certainly get more during your time at UVA and in your year or years. And you should be pursuing medical school, MD or DO. And I think most importantly, a desire to learn and work collaboratively. One of my favorite aspects about UVA was how amazing the community was. I regularly studied with my classmates, and although we did stuff outside of school too, some of my favorite memories were bonding over studying for tests or doing a difficult homework assignment together at the library late at night. So I think that that is a huge asset for the program, and the students really help and support each other.
So here's some resources available to prospective post-bac students and applicants. One of them being the AAMC Post-Bacc database. So this is a database of 250 plus programs all across the US where you can do custom search features looking specifically for career-changing programs or academic record enhancer programs. The Post-Bacc CAS or Post-Bacc CAS is like a common application service that UVA uses during its application process. It contains over 50 plus programs, and this application service opens in mid-August. That's also when our application opens on the Post-Bacc CAS and closes on March 1st. And we'll interview qualified candidates during that time frame as well.
Thank you for listening. And if you guys have any questions, please feel free to email us at postbac@virginia.edu.